Hello students, today we are going to learn about the short wave diathermy. Short wave diathermy. It is commonly abbreviated as SWD. Okay, so it is universal short form for short wave diathermy. And if we consider the Indian scenario, so most of the physiotherapy clinics, they are using this modality most frequently, okay, for pain relief. So let us go in detail. Now, what is shortwave diathermy? So, it is the use of high frequency electromagnetic waves for the treatment purpose. So, high frequency means what is the frequency that is falling into this high frequency? So, if we consider low frequency, so the ranges from this low frequency, it is from 1 to 1000 hertz. For medium frequency, the range is 1000 to 10,000 hertz, and for high frequency, the frequency should be more than 10,000 hertz. So in short, high frequency means frequency should be more than 10,000 hertz. Okay, so that will be considered high frequency. Okay, now what should be the specific frequency for this shortwave diathermy? So frequency for shortwave diathermy, it is from 10 raised to 7 to 10 raised to 8 hertz. Clear? So high frequency means more than 10,000. Now if we go specifically for shortwave diathermy, so the range of frequency is from 10 raised to 7 hertz to 10 raised to 8 hertz, and the wavelength is ranging from 30 to 3 meter. Now this shortwave diathermy, it is generating heat inside the body. So this is the major difference between the simple heating pad or electric heating pad or hot pack. Clear? So this all the objects like hot pack and heating pad, they are becoming hot. Okay, so when they are coming in contact with our body part, so they will transfer their heat into our body. Just because they are hot, they will transfer this into our body. Now actually the skin cannot tolerate more than 44 degrees Celsius. Okay, so after that the skin will start burning. Clear? So there will be always one limitation that I cannot increase the temperature of electric heating pad or hot pack after particular limit. Otherwise, if it becomes too hot, then it will start damaging my body. Clear? So the shortwave diathermy, what it is doing, it will be producing heat inside our body. Clear? So if you touch only one pad of this shortwave diathermy, you will not feel hot. But if you touch both of them together, then and then you will feel hot. Why? Because then the circuit is complete and the heat is produced inside your body. Clear? So this is the major difference between our simple hot pack or electric heating pad and this shortwave diathermy. All others, they are working on method of conduction, and here it is literally producing heat inside our body. Clear? So how it is producing, that we will learn. Now this is one of the modality that provides deepest form of heating, okay, for physiotherapists. Another modality is also there, that is known as microwave diathermy. But still, if we compare this shortwave diathermy and microwave diathermy, so definitely the shortwave diathermy, it is having more penetration depth. Penetration depth means it will go deeper to the tissue. Okay, and the word diathermy, diathermy means it is throughout heating. Clear? For example, one pad is on my medial side of the knee and another pad is on my lateral side of the knee. Okay, so this waves will literally travel from this medial pad to lateral pad, okay, throughout from knee joint. Clear? So it is thorough heating, we can say. That's why the word used is diathermy. Diathermy means it is thorough heating, throughout heating. Clear? So it is one of the deepest form of heating modality. Okay, now we know that this range is for shortwave diathermy, that is from 10 raised to 7 hertz to 10 raised to 8 hertz. Clear? But all these frequencies we cannot use, otherwise it can cause interference with other frequency, or it can cause interference with other instrument those are using same frequency. So there should be dedicated frequency for particular use. For example, if I want to listen radiometry, so the dedicated frequency is there, that is 98.3. okay, so here also there should be dedicated frequency. So there are three dedicated frequencies are there. Okay, so first of all, it is 27.12 megahertz. Okay, and wavelength will be 11 meter. Clear? So the product of this frequency and wavelength will be always constant. Clear? So if the frequency changes, wavelength will also change. So now it is most commonly used frequency. We should always remember 27.12 megahertz frequency and 11 meter wavelength. Okay, I repeat, 27.12 megahertz and 11 meter wavelength. Okay, now which are other two frequencies? So they are less commonly used frequencies. Okay, so frequency is 40.60 hertz with wavelength of 7.5 meter, and another frequency is 13.56 megahertz along with a wavelength of 22 meter. So these are three dedicated or specially allocated frequency for shortwave diathermy, especially for therapeutic effect. Now, what is the principle, okay, or how this shortwave diathermy will be produced? So we know that it is not possible to produce this much high frequency current. This much high means 27.12 megahertz, means 27.12 multiplied by 10 raised to 6 hertz. So it is very high frequency. So it is not possible to produce by simple mechanical device. Okay, so we need to do something extraordinary with this circuit. Clear? So for this type of the circuit, it is possible only by discharging the condenser. Condenser means it is capacitor. Clear? So it is possible only by discharging condenser or capacitor through an inductance of low ohmic resistance. Means there should be use of inductor as well as capacitor. Okay, then and then this frequency will be produced. Why? Because this frequency, then inductance and capacitance, okay, all these are correlated. Okay, what is the relation that we will see? Clear? But at least for this much high frequency, what we need? Inductor and condenser or capacitor. Condenser, capacitor, both are same. Now, this is the formula. Okay, F is frequency, is equal to 1 upon 2 pi under root LC. Clear? So here F is frequency, L is inductance and C is capacitance. So here 1 and 2 pi, they are constant. So we can say that F is inversely proportional to inductance and capacitance. Clear? So definitely if I want more frequency or higher frequency, I should keep my L and C less. Or if I need less frequency, okay, or low frequency, my L and C should be high. Why? The reason is same. F is inversely proportional to L and C. Clear? Okay, so what is the relation here? So if the current of very high frequency is required, definitely capacitance and inductance should be small, and if a current of low frequency is required, the capacitance and inductance should be large. Okay, so that is very simple principle, that frequency is inversely proportional to inductance and capacitance. Now, construction of this circuit. So circuit will be divided mainly into two parts. Okay, so machine circuit, that is also known as oscillating circuit, and patient circuit. Okay, it is also known as resonator circuit. You can see the circuit of this shortwave diathermy here. So let us see part wise. So you can see on left side there is mains power. So that is nothing but whenever we are using this shortwave diathermy machine, we are putting plug into the socket. So at least the machine is getting electricity. Now this electricity will be at low voltage, generally at 220 volt. Clear? So there will be installment of one step up transformer that may increase this voltage sometimes up to 1000 volt, 2000 volt, and it may reach up to 4000 volt also. And there will be installment of triode valve circuit. Okay, so by this step up transformer, by getting a very high voltage maximum up to 4000 volt, this triode valve circuit will be producing high frequency current, and that will be given to oscillator coil by amplifier. Clear? So this oscillator coil will be having one capacitor and one inductor. So capacitance of this capacitor and inductance of this inductor in oscillator coil will be fixed. So if you consider oscillator coil as coil number 1, clear? So it will be having one capacitor and one inductor. Clear? And if you can give number 1, so C1 and L1 both will be constant or both will be fixed. So capacitance and inductance of this oscillator coil will be constant or it will be fixed. Okay, now coming to resonator coil or resonator circuit, it is also known as patient circuit. So here inductance will be fixed but capacitor will be variable. Okay, so inductance will be having constant value but the capacitance of capacitor may be changing, okay, depending on patient's body tissue, depending on spacing, depending on types of electrode. So here in resonator circuit only you can see this is the part of patient. Clear? So now if you compare, so capacitance and inductance of oscillator coil will be fixed. Okay, so if you consider one, so C1 L1 they are fixed. Okay, now in case of resonator circuit or patient circuit, okay, inductance will be constant. Okay, so that is nothing but L2 you consider, but your capacitor will be variable, so definitely the value of capacitance will not be constant. Clear? So here C1L1 that is of oscillator coil and C2L2 they are of resonator coil. Out of this C1, L1 and L2, these three are constant. Only variable is C2. Okay, C2 means it is capacitance of patient circuit or capacitance of resonator circuit. Clear? Okay, now when you give this short wave diathermy, so it is possible to give by two methods. One is by condenser or capacitor filled method, where we are using two pads, those are working as plates of capacitor, and patient's body tissue may come between these two plates of capacitor. Another method is cable method. So in cable method, one cable will be giving this inductance and that cable is wound around the body part, especially limb. Okay, so by formation of this electromagnetic field around this cable, the part is being treated. Now, as we discussed that there are two capacitors and two inductors. Okay, so if we want maximum output, we should go for tuning of the circuit. Okay, and this phenomena it is known as resonance. Okay, this is known as resonance. So resonance means what? C1L1 should be equal to C2L2. C1L1 should be equal to C2L2. Clear? So now we know C1 means it is capacitance of oscillator circuit, L1 means it is inductance of oscillator circuit, C2 means it is capacitance of patient circuit, and L2 means it is inductance of patient circuit. Clear? Now here C1, L1 and L2 they are constant, they are fixed. So just by changing the tuning knob, we are changing the capacitance of patient circuit. So we are manipulating C2 in such a way that C1L1 is becoming equal to C2L2. So it provides maximum energy transfer from machine to patient's body. Okay, how we come to know? So that is by this indication. Either you may be having indicator light on your machine. Okay, so it will be on. Okay, or it may change its color. Okay, based on manufacturer company. Okay, so you can confirm that now it is in resonance. Okay, now in few machines you can have idea from this emitters. So emitter will show maximum deflection. After that maximum deflection, if you rotate this tuning knob clockwise or anti-clockwise, the deflection will reduce of emitter. Okay, in third possibility you might be having neon gas tube. So that is nothing but simple tube light what we are using at our home. So if you put that in the field of this capacitor or in the field of this short wave diathermy, so it will be growing with maximum intensity or maximum light. Clear? So by all this way, either by indicator light or by emitter or by using neon gas tube, you can confirm that this is machine that is in tuning or that is giving resonance. Okay, why? Because we want maximum energy transfer from machine. Now, effects of electric field on conductors, insulators and electrolytes. Okay, so there are three mechanisms by which heat will be produced inside body. Okay, heat will be produced inside body. So which are these three mechanisms? So first is ionic vibration, where the ion will vibrate. Then there will be molecular distortion. Okay, so molecules, so they are having orbits, so orbits definitely it will be negatively charge because of the presence of electron, and nucleus will be having positive charge. Clear? So orbits will be distorted. And dipole rotation, dipole means they are having two contents like sodium chloride, so it is having sodium as well as chloride. Okay, so how these are working in production of heat, let us understand. First we will go for ionic vibration. So here you can see multiple ions, they are scattered, including positive as well as negative ions. Okay, so they are between the two plates of capacitor. So here if you see these two plates, they are having ions between them. Okay, but they are not having any charge. Okay, let us charge this plates of capacitor. So now you can see the plates are charged. Okay, on left side you can see that plate is positively charged, and on right side you can see plate is negatively charged. So if you compare with the previous picture, let us go for previous picture. This is previous picture. So here positive and negative ions, they are mixed, but now after applying electric charge on the plates, they are moving, means negative ions, they are towards positive plate, and positive ions, they are towards negative plate. Clear? So this you can see. Now as we know that this shortwave diathermy, it is having frequency of 27.12 megahertz. Okay, so polarity will change automatically. Okay, now there will be one question whether it is AC or DC. So whenever we have frequency, definitely it will be AC, it is alternating current only. Why? In case of DC, frequency will not come. Why? Current itself, it is not changing its direction, so there is no provision of frequency in case of DC. So here the frequency is there, so definitely it is alternating current, so definitely the polarity of these plates will also change. So how it will be changed? Now you can see the positive plate, it is on right side of the slide, and negative plate, it is on left side of the slide. So now the positive ions, they are moving towards this negative plate, and negative ions, they are moving towards the positive plate. So this type of movement will happen. Clear? Okay, this is very slow movement that I am showing you, but just imagine that if you consider actual 27.12 megahertz, so what will happen? So this ions, they are in center. Okay, now as you can see, positive ions, they are attracted towards the negative plate, so that is on left side of the slide, and negative ions, they are attracted towards the positive plate, that is right side on the slide. Clear? Now when polarity will change, so they will also change their direction, but immediately the polarity will be changed. Why? Because it is very high frequency. Clear? It's very high frequency. So actually what is happening, instead of movement of ions, we can say that they are vibrating. So definitely this movement will be producing your heat. Now coming to molecular distortion. So here they are nothing but insulators. Clear? So this molecules you can see, so outer orbits, definitely they are having negative charge because of presence of electron, and inside it is positive because of presence of protons. Clear? So and if you concentrate on orbit also, so they are circular. Okay, this orbits, they are circular, but when this charge is applied, because here you can see there is no charge on the plates, but now we are applying the charge. Clear? So on left side we have positive plate, on right side we have negative plate of this slide. So this positive plate will attract orbit towards that side. Clear? So you can see that orbits, they are becoming oval. Why? Because orbits are attracted towards positive side. Okay, now we are comparing with the previous slide. So this is previous one. Okay, so where the orbits are circular, and positive ions, they are exactly in center of molecule, but after applying this electric field over the two plates of capacitor, what is happening? Orbits, they are pulled towards positive side. Now again, as we discussed, this is alternating current, so definitely the polarity will change. Okay, so at present positive side is on left side, negative side it is on right side. Okay, so this is about charging. Now that will change. So now positive plate is on right side and negative plate, it is on left side. So orbits, now they are pulled towards right side, okay, or positive side, and positive ions or nucleus, those are attracted towards left side. Okay, why? Because the left side, it is negative plate. Clear? So how they are getting this distortion? So you can see. Okay, this is how they are moving. So now actually what is happening, because of this molecular distortion, this kinetic energy will be converted into heating energy. Now coming to dipole rotation. Okay, dipole rotation. So compounds. Okay, so this dipoles, they are having best example sodium chloride. Okay, so they will be having sodium, so that is Na plus, okay, and Cl minus. So they are having positive as well as negative ions, but electrically now they are neutral. Why? Because now they have been converted into compound. Okay, so they are electrolytes, we can say. So definitely multiple electrolytes, they are present into our body. Clear? So these are the dipoles, but here again the plates, they are neutral. Okay, on the both the sides of this dipoles you can see two plates, but they are neutral. Okay, they are not having any charge. But when we apply the charge, what will happen? See, the negative side of this dipole will be attracted towards positive plate. Okay, so positive plate is on left side, so the negative particles, that is Cl minus in our example, will be attracted towards positive plate. Okay, and positive part of this dipole, so for example sodium Na plus, that is in our example, so Na plus will be attracted towards negative side of plate. Clear? So if you compare this with the previous figure, so here this molecules, they are in random direction, but when this electric field is applied over two plates of the capacitor, they will be in particular direction. Clear? So negative part of the dipole, okay, that will be towards the positive plate, and positive part of the dipole, that will be towards the negative plate. Okay, now again the polarity will reverse. Okay, definitely it will reverse because it is use of alternating current. So after change in polarity, what will happen? Now the positive side has gone to right side. Okay, positive plate, that is on right side, negative plate, it is on left side. So now what is the change in dipole? Negative side of this dipole, that is towards positive plate, and positive side of dipole, that is towards negative plate. Okay, so now when the frequently polarity will change, what will be the movement? So movement will be like this of dipole. Clear? So they will be rotating, you can see they are rotating. Clear? So if they are rotating, definitely it is producing energy. So in case of ionic vibration, in case of molecular distortion, or in case of this dipole rotation, ultimately what is happening? Joule's law. Clear? Joule's law, what it is telling, that amount of heat produced, that is Q, will be equal to square of current intensity, okay, then multiplied by resistance multiplied by time duration. Clear? So here as per Joule's law, this kinetic energy will be converted into heating energy. Clear? So it depends on what? It depends on amount of current, it depends on resistance of the skin, and it also depends that for how much time you are giving this exposure to shortwave diathermy. Clear? So as per Joule's law, heat will be produced inside body. Okay, so without increasing temperature of your skin, okay, it will increase the heat inside the body. Clear? If you want to check practically, you can touch one single pad of this shortwave diathermy. You will not feel that temperature of that single pad as hot pad. Clear? Okay, but if you touch both of them together, so definitely the circuit will be established from your body part, and it will produce heat inside. Clear? So now how this electric field will be entering into your body, okay, or which are the factors those are affecting this concentration of this electric field? So we have to consider one terminology that is known as dielectric constant. So it is nothing but ratio of capacitance of any body, okay, divided by, that is capacitance of air. Okay, so it is C by C0. So for example, if we consider human body only, so approximately as per different literature, our dielectric constant is 80. Clear? 80. It is C by C0, so definitely there will not be any unit, okay, like kilometer, then seconds, hertz, all these are units. But for this it is ratio C by C0. Clear? So Faraday divided by Faraday. So there is no unit. So dielectric constant, so as compared to capacitance of air, our body's capacitance will be almost 80 times higher as per literature. So we can say that our dielectric constant of human body is on an average it is 80. It may be different from person to person, but on an average we consider it 80. Clear? So what is happening if the tissues they are having low impedance means they are having low resistance, clear? For example, blood and muscle, so they will be having high dielectric constant, clear? So simply remember, low resistance, high dielectric constant, for example, blood and muscle, okay? And the tissue of high impedance, so that is high resistance, for example, fibrous tissue and fat, they are having low dielectric constant, clear? They are having low dielectric constant. So in short, low impedance means high dielectric constant, or high impedance means low dielectric constant. Now this electromagnetic field, it will always prefer to enter into high dielectric constant material, clear? So if dielectric constant is higher, okay, definitely that electrostatic field will enter into our body, clear? Now what will be the relation between this organization of this electrostatic field and organization of our body tissue? So it is like this only, that if the different body tissues they are parallel to the electric field, okay, means the body tissues and the lines of this electric field, okay, if they are parallel, then what will happen? So heating will be greatest in tissue of low impedance, okay, or we can say they are of high dielectric constant, clear? So when this field is passed longitudinally means this electric field and body tissues they are parallel, okay? So when it passes longitudinally through the limb, blood is heated more. Why? Because it is having low impedance or high dielectric constant, okay? Now what if it is transverse? So if our body tissue and this electric field they are transversely arranged, okay, or we can say they are perpendicular to each other, so heat production will be greatest in tissues of high impedance or tissues of low dielectric constant, clear? So in this case fat will be heated more, okay, as compared to other tissues, clear? So in simple, if the electric field, okay, and body tissue, if they are parallel, so heating will be more in case of low impedance tissue, okay? So they are nothing but high dielectric constant tissues, okay, for example blood. And if this electric field and our body tissue they are perpendicular to each other or they are transverse to each other, so heating will be more in the tissues of high impedance or tissues having low dielectric constant, clear? For example, fat. Now actually in our body it's not like that there will be purely longitudinal tissues or there will be purely transverse tissues, okay? It is always mixture of this two. So this electric field, okay, it will neither come parallel or nor come longitudinal or transverse, okay, in actual meaning, clear? Definitely it is possible that few tissues they are more in parallel as compared to transverse, or few tissues they are more in transverse as compared to parallel, clear? So it is possible that it may deviate to one side, either longitudinal side or transverse side, but it is not purely we can say that it is 100% longitudinal arrangement or it is 100% transverse arrangement, clear? So it is always mixture of these two, okay? In this case mostly the blood is heated more, clear? And this heating of the blood, okay, will be transferred to nearby tissues by conduction method, clear? So this heated blood will also increase the temperature of nearby tissue, okay? If you think of muscle, fat, because they are also getting heated, okay, blood is heated most, but other tissues they are also getting heated. So if they are heated internally, okay, so all these tissues they will be allowing this heat to transfer by conduction, and that is good also because it prevents accumulation of heat. Because if the heat is concentrated on particular area only, so definitely there are chances of burns. So it is good that the heat is getting disseminated or it is spreading by conduction. Now if the muscles, we thought of blood, okay, but if the muscles surrounding the deep placed joints if they are heated, so definitely the some heat will be transmitted to joint, okay, by conduction, okay? If the blood is heated in that part, definitely it will provide heat to other tissues. Which are the other tissues? Like muscle, fat, etc. Okay, and this heat is carried away. So what we are doing, we are able to prevent the overheating of that part. Okay, we are able to avoid this overheating, so we are able to prevent the burns. Clear? So also it is helping that heating other tissues which are not in direct contact with this electric field, they will also be treated. Clear? Because see, this is not invasive procedure, so it's not like that by placing particular placements of this pads of the shortwave diathermy we can target particular tissue. Okay, like if I want to treat particular area of fascia, okay, so that is not possible. Or if I want to treat particular part of the bone by shortwave diathermy, that is not possible. Clear? Directly I am not in contact with that part, but if I am able to produce heat, okay, in the nearby tissues of this part that is targeted by me, okay, so definitely by transfer of this heat, that part will also get this heat. Okay, so that will be useful to that part where we cannot approach directly. Okay, or that is not in direct contact by this electric field. Okay, now when the shortwave diathermy is applied by capacitor field method, the production of the heat, it is determined by distribution of electric field. Okay, so where it is more, so definitely it is more in the superficial tissue. So that we will learn in electrode placement also, that if the electrode placement is not proper, so superficial tissues will be getting heat more as compared to deep tissues, and clinically we need this shortwave diathermy for the treatment of deeper tissue. So what is happening, actually we want to give heat to the deeper tissue, but simultaneously the superficial tissues like skin, fascia, they are also getting more heat. Okay, so there are chances of getting burns to this skin or fascia part. Clear? Now tissue of low impedance, so they're also getting this more heating. Why? Because the low impedance tissue, they will be having high dielectric constant. So definitely the high dielectric constant tissues will be the preferred tissue for shortwave diathermy to enter. Clear? So diathermy waves, they are always preferring this low impedance or high dielectric constant tissues. Clear? So here you will be having greatest distribution of electric field. Clear? So in short, electric field in the body is not like that whatever the schematic diagram of electric field we draw on paper. Okay, it will be like that but not exactly. Clear? So it will be based on this impedance and dielectric. Clear? So different tissues, they are having different impedance and different dielectric constants, so this electric field distribution will be also affected by that. Now electrode placement, whenever we are going for this shortwave diathermy, so we have to consider following parameters or factors. Which are they? So first is we have to consider the type of electrode, that which type of the electrode we can use for optimum output. Second, it is size of electrode. It should be optimal size, neither larger nor smaller. Clear? Okay, so that is size of electrode. Then comes spacing of electrode. So here the shortwave diathermy pad, it is not in direct contact with skin. Clear? So it is always separated by some insulating material like bed sheet or any cloth. Clear? Sometimes even air, especially when we are using disc electrode. So in short, the pad of this shortwave diathermy or this plates of capacitor for capacitor field method, it is not in direct contact with skin. Okay, it is separated by some insulating material, but this insulating material will be supportive of electrostatic field at least. Clear? Insulator means it is not allowing current to pass, but definitely it will be allowing the electric field to form. Clear? So mostly in clinical practice, what is used? Bed sheet. Clear? So this bed sheet will be there. So on one side of the bed sheet you will be having patient's body part, and on another side of the bed sheet you will be having this pad of the electrode. So how this spacing is also affecting, that also we need to consider as one of the factor. And positioning of electrode means they are in the same plane, they are in the different planes, okay, etc. So let us go one by one. So type of electrodes, so you can see different types of the electrodes here. So one will be thin malleable plate that will be covered with insulating material, especially cloth only. Clear? So if the plate is thin or if the electrode is thin, it can be molded to irregular body part. For example, if I want to treat the knee joint or shoulder joint, so they are not flat, okay, they are in round shape, so they are having curve. So definitely as per the curve of body, this plate should be molded, clear, so that each and every part of the shoulder joint or knee joint, they are getting same amount of intensity, same amount of exposure, clear. Okay, so thin plate, it is having one advantage, that it is flexible. Okay, so we can mold it as per shape of our body part to be treated. Another is thick plate, clear, thick malleable plate, okay, covered with any insulating material, clear. So that will be having that disadvantage, so it will not be flexible. But for flat areas like back, we can use this thick plate also, clear. So based on our requirement, we have to select this electrode. Third electrode, it is disc electrode. So you can see there are two disc electrodes. It is looking like disc, compact disc, that's why the name is given disc electrode. So they are in both the sides of knee joint in this figure, you can see. But here what is the advantage? You don't need any spacing material. You can see that there is knee joint, okay, on both the sides of the knee joint there are this disc electrodes, but between this knee and disc electrode there is nothing, it is just presence of air, clear. So air is working as spacing material. Okay, if you think of this thin or thick malleable plates, clear, so in that case this is not possible. Okay, instead of air you need to place bed sheet, okay, or some cloths. Okay, so here they will be working as spacing material. Here air is spacing between the knee joint, that is patient's tissue, and disc, clear. Now coming to types of electrode, so first of all we have to consider the shape also. So as we can see in the figure A, the corners, they are sharp, clear. So there will be more concentration of electric field over the corners, and it is possible that there are chances of burns over this sharp corners, clear. Okay, but if we consider the figure B, so this electrode, they are having rounded corners, clear. So this electric field, it is not getting concentrated over this corner as compared to A figure, clear. So especially you compare the corners of figure A and figure B, clear. So in the case of B, the electric field is more even. So definitely the rounded corners of this electrodes, they are advisable. Now if the electrodes, they are of unequal size, so you can see that one electrode is larger and another electrode is smaller. So whenever you want to charge this type of the electrode, so definitely there will be unequal loading and you need more charge to be delivered to large electrode. Okay, that is also fine, but it is useless. You can see in this figure that some part of the larger electrode, that is in the upside as well as downside, they are not in use. Okay, so they are totally wasted. So it is not advisable to use this unequal size of electrodes. Now if the electrodes, they are of adequate size, now adequate size means what? So they should be slight larger as compared to body tissue. So whatever you can see in the form of circle between these two plates of capacitor, you consider that it is patient's knee joint. Okay, this circle, it is patient's knee joint, and the patient's knee joint, it is treated with two plates. So we can say that more than knee joint size, you should be having size of plates or electrodes, clear. Plates, electrodes, both are same. So here the size of this electrodes should be slightly larger than body tissue. So what is happening? There is even distribution of this electric field, clear. So on superficial part also you can see that there is no concentration of heat, okay, and in the deeper tissue also there is good distribution of this field, clear. So adequate size means slight larger electrodes as compared to size of body. Now if the electrodes, they are of smaller size than body, so here again the circle is, you consider as knee joint of the patient, clear. So electrodes, they are smaller as compared to knee joint. So what is happening in this? Okay, deeper tissues, they are getting this good amount of heat, that is fine, but the electrodes, they are having more concentration over the superficial tissue. And what has Bad part, superficial tissues, they are not able to tolerate temperature. Clear? So if the electric field it is concentrated on the skin, so skin will not be able to tolerate more than 44 degrees Celsius. Clear? So again there are chances of getting burns. Clear? So if the electrode size is smaller as compared to body, so there are more chances of concentration of this field, okay, over the superficial tissue, and you may have chance for burns. Now if electrodes they are quite larger as compared to body, so you can see that only few amount of this electric lines they are passing from human body. So circle is again knee joint between the two plates, but rest of the electric field it is wasted. Clear? So definitely it is waste of energy, so definitely it is not advisable to use larger size, okay, much larger size as compared to body. Now coming to spacing, so if the spacing is too small, clear, so what will happen, just because of this small spacing, we are talking of spacing between the electrodes. Clear? Spacing will be also there, we have to consider for the distance between the electrode and patient's body tissue, okay, but here we are talking of spacing between electrodes. Clear? That spacing, that is spacing between pad or electrode and patient's body tissue, we will cover later. Clear? So if the distance is too less between the electrodes, so there will be spreading of this electric field that will be limited, okay, that will not be expanding more, because they will be getting very nearest way or very smallest way to reach to the opposite electrode. Clear? So here by less distance the spreading of the field will be limited. Now again adequate distance. Clear? So if the distance is adequate, okay, so it is having relation between this spacing between the body tissue and pad also, so I will tell you at that time. But here if you see, so if they are placed at adequate distance in such a way, so the distribution of electric field is good. You can see that there is no concentration of the field over the superficial body tissue or deeper body tissue. Clear? So we should put some amount of spacing. Clear? Okay. Now if one electrode is nearer and another electrode is far, okay, so that will be also having effect. And if the electrodes, if they are very closer to the body, then also they are having effects. So in this case, if the electrodes they are quite closer to the body, so what is happening, again you will be having more concentration over the superficial tissue. Clear? So electrodes they should not be very closer to the body, because one is superficial heating that will be there, okay, so that is not desirable, and another is again there will be limited spreading of this electric field. Clear? So if the expansion of this field or the spreading of the field is limited, so tissues treated will be also less. Clear? So electrodes closer to the body is also not advisable. Now at uneven distance. Clear? So one electrode is nearer and another electrode is far. So as we can see in this figure, the electrode that is nearer, that will be causing concentration of this electric field over the skin, okay, but the electrode that is far from the body tissue, that will be having even distribution. So here there are chance that the body part, okay, that is nearer to this electrode, okay, or the nearer electrode to the body part may damage the superficial tissue on that part. Clear? So here in this example if we see, so on left side the electrode is nearer as compared to body, so on this left side there are chances of getting burns. Now spacing of the electrode, okay, so very less distance. So now I am telling that relationship which I explained you before, that I will tell. So as we discussed, that spacing will be between these two electrodes as well as spacing will be between electrode and body tissue. So here there is one relationship, that the spacing between two electrodes, okay, listen properly, the spacing between two electrodes, definitely it should be larger as compared to total width of spacing between electrode and body tissue. Clear? I repeat, spacing between two electrodes should be larger as compared to or should be larger than total width of spacing distance between electrode and body tissue. Clear? So if you consider A and B as electrode and lower line it is body tissue, so the distance between A and body tissue, distance between B and body tissue, okay, make a total of this. Clear? Now whatever the spacing is required between these two electrodes, that should be definitely more than this total. Clear? So I repeat, the distance between A and body tissue plus distance between B and body tissue. Clear? So that is total width of the spacing between electrode and body. Okay. Now distance between two electrodes should be larger than this total width. Clear? Otherwise the field will directly go from A to B without entering into skin. Clear? So this spacing calculation will be helpful to decide the spacing between two electrodes as well as spacing between body tissue and electrode. Now coming to positioning of electrodes. So if both of the electrodes they are coming in same plane, it is known as coplanar method. So in the figure A you can see that both the electrodes they are in the same plane, and the straight line in the figure A it is showing you body tissue. So the field is spreading inside the body tissue. Clear? So best example for this treatment it is back pain. So patient is in the prone lying position, okay, and over the back of the patient two electrodes are set. Clear? So these two electrodes will be forming electric field from the patient's body, okay, and that will be known as coplanar method. Again in the figure B, if you reduce this distance between the two electrodes, so field will not be entering into body. Okay, instead the field will be between two electrodes only, it will not be entering into body. Clear? So this distance between two electrodes should be larger than total width or total distance between the electrode and body tissue. Now contraplanar. So contraplanar means both the electrodes are on opposite side of the limb. Clear? Like knee joint, if you consider as a circle, so one is medial side, one is lateral side. So one electrode will be on medial side, one electrode will be on lateral side. So here both the electrodes they are parallel to each other, but they are in different plane. Yes, so they are in different plane. So that is known as contraplanar method. So very simple, coplanar means in the same plane, contraplanar means it is in opposite or different planes. Now monopolar method. So here only one electrode will be used, okay, for the placement. Another electrode will be put anywhere, or sometimes it is not used at all. Clear? So monopolar electrode means they are having two electrodes, but one will be active, that you can say, okay, or one will be used, okay, and another will not be used, or it will be put anywhere as reference electrode. Don't get confused between the monopolar and monode electrode. Monode means it is only one, but here monopolar means there will be two, but one will be active, that will be actually utilized for treatment purpose. Clear? So this is monopolar electrode. So it should be at somewhat distance, okay, for even distribution of this electric field. Now crossfire method. So this placement will be changed, okay, so half of the treatment is given as per diagram on the left side, and half of the treatment will be given as per diagram on right side. Clear? So here what is happening, that half tissue will be treated in the first session and half tissue will be treated in next session. So if you think of the knee joint, so initially the electrodes they are placed on medial side and lateral side of the knee joint, okay, and in the second session it is placed on anterior side and posterior side. So all the tissues will be getting treatment properly. Clear? So this is most commonly used for knee joint or sinus or some pelvic conditions. Clear? So where tissue will be treated in two sessions. Clear? Now what are the physiological effects? Okay, so what are the changes those are happening in our body when the shortwave diathermy it is given? Okay, so the list is here. Effects on metabolism of body. So as per Van Hoff's law, what is statement that any chemical reaction, okay, that will be accelerated by heating. Clear? So if any chemical reaction or any chemical process is happening in our body, so that will be accelerated, or that will be getting more speed by this shortwave diathermy. Okay, it is aggravated by any type of the heat, but here the shortwave diathermy, it is producing heat, so the metabolism that will increase, because metabolism, it is nothing but one type of the chemical process. Okay, anabolism, catabolism, both will increase just because of production of heat. Why? Because metabolism is chemical process, and chemical process that will be accelerated by heating. Clear? Now, effects due to increased blood supply. Now you listen this carefully, because this event will be repeated frequently for other effects also. So whenever we are giving heat, okay, so means whenever we are giving shortwave diathermy, so there will be vasodilatation. So vasodilatation means definitely there will be more blood supply. Clear? So if the shortwave diathermy is given, so it will lead to vasodilatation. So because of this vasodilatation, more fresh blood will be coming to that part. So definitely if the fresh blood is coming, it will also come with antibodies, it will also come with nutrition, it will also come with proper oxygen. Clear? It will also come with new amino acids for protein synthesis. So protein synthesis will lead to this healing process. Clear? So this fresh blood is coming with nutrition, oxygen, antibodies, clear, amino acids. So definitely it will promote healing process. Okay, and it will be also giving relief to pain. Okay, effect of heat on nervous tissue. So definitely our sensory nerves, those will be stimulated. Okay, and this heating will be having soothing effect on our nervous system. Clear? So many times in clinical practice also you will see that while taking diathermy, patient will sleep. Why? Because of pain, patient is not properly sleeping at night. Clear? Pain is carried by lateral spinothalamic tract. So if you remember, or if you go in detail of anatomy of this lateral spinothalamic tract, so it is passing from reticular formation. Clear? So reticular formation means it will increase your alertness, it will increase your awakeness. Clear? Whenever the pain is more, okay, so definitely there will be stimulation of lateral spinothalamic tract. So lateral spinothalamic tract will stimulate your reticular formation, so that will increase your awakeness. So definitely increased awakeness will not allow you to sleep properly. Clear? So whenever the heating is given, so there will be inhibition of all these events, okay, by peripheral level type of pain modulation. Clear? So this heat will promote pain modulation. Okay, it will be having soothing effect, it will be having sedative effect on your nervous system. So many times the patients, while taking shortwave diathermy, they will be sleeping. Why? Because they are getting pain relief. Yeah, so actually it is not advisable that patient should not sleep. Okay, so we should not allow the patient to sleep, but just because of this sedative effect on nervous tissue, they are sleeping. Okay, so this is one of the physiological effect. Now effect of heat on muscular tissue. So because of this increased blood supply, as I told that this event will be repeated frequently of more blood supply, okay, because of vasodilatation. So muscle will be also getting good fresh blood, okay, and muscle will be also getting relaxation. Clear? So good blood, that is for proper nutrition of the muscle, as well as because of this heating, muscle will be also having relaxation type of feeling. Clear? Effect of heat on sweat glands. So that all we know that heat will increase the activity of sweat glands. So by stimulation of sweat glands, we will be having more sweat, we will be having more perspiration. Clear? So heat will stimulate this sweat glands, and we will be having more amount of perspiration. That is one of the physiological effect. Now therapeutic uses. So how this shortwave diathermy will be useful? So that is nothing but if we know the physiological effect, we can directly write the therapeutic effects. Clear? Okay, so where this shortwave diathermy will be useful for treatment purpose. Okay, so that will come under the therapeutic effects title. So first, it is having effect on inflammation. So this inflammation, that is having reduced blood supply, generally it is confined to particular local area. Clear? So by giving this shortwave diathermy, it will produce heat, so definitely it will increase blood supply. Clear? So this inflammatory process will be drained. Okay, because as the new blood is coming, so old blood, okay, that will be drained away. So definitely whatever the accumulation of waste metabolites were there, that will be also drained. Clear? So that will reduce inflammation. But again, we have to take care that this shortwave diathermy should not be given in acute inflammation, that is in very acute stage of 2-3 days of injury. Clear? So in that case, shortwave diathermy may cause problem. Okay, so icing will be given for initial acute condition, but in chronic conditions definitely the inflammation will be reduced by shortwave diathermy. Then effects in bacterial infection. So here also the fresh blood supply will come with more amount of antibodies, so that will reduce this bacterial infection. But it is not like that we are increasing the temperature of the body tissue that much that it will kill the bacteria. Okay, so this is misunderstanding. It is not possible to increase the body temperature to that level that it can kill bacteria by thermal effect. Okay, it is not possible, but by giving fresh blood, fresh oxygen, fresh antibodies, okay, definitely it can fight with the bacteria. Okay, and you will be having antibacterial effect. So for bacterial infection it is good. Now relief of pain. So as we discussed in physiological effect, this nervous tissue, they are having soothing effect. Okay, and by this drainage of these waste metabolites, those are commonly responsible for pain. Okay, like accumulation of the lactic acid or other waste byproducts. Clear? So those will be causing pain. So by giving this shortwave diathermy, the fresh blood will come. Okay, so at the same time the old blood, okay, that will be drained away. Okay, so this drained process, okay, so that is also carrying waste metabolites along with them. Okay, so that will give you pain relief by this removal of the waste metabolites, as well as by giving soothing effect on nervous system. Effects on muscle tissue. So muscle will be getting more blood supply, so definitely it will also function well. So many clinicians, they are also advising to give shortwave diathermy before the active exercise, so that muscle will be giving good performance. And this muscle, it is getting hit, so definitely it will also work as one of the warm-up activity. Before exercise definitely we need warm-up. Clear? So here the temperature of muscle will increase, so it will be able to perform in efficient way. In case of traumatic condition, definitely there will be inflammation, there will be pain. Clear? So after this traumatic condition like fracture or some mechanical problems like knee pain or back pain. Clear? So shortwave diathermy will be helpful. Okay, so it may reduce the stiffness of the joint. Okay, it will increase the blood supply, so that it will also make it possible to give exercise after this traumatic conditions. Clear? So in case of traumatic conditions, it is reducing pain, it is reducing inflammation, it is reducing stiffness also. Now this is reducing healing time. So as we discussed, new fresh blood will also come with amino acids, and this amino acids will be making protein. Okay, so this protein synthesis, it is nothing but healing. Clear? So definitely by promoting this supply of amino acids, we are promoting protein synthesis, so we are promoting this healing time. Okay, we are reducing this healing time. Clear? So that is very simple explanation. Now few dangers are there. Dangers means this may be possible whenever the patient is taking shortwave diathermy treatment. So we have to take care that any of this danger is not occurring in our clinical practice. First and very common, that is burns. Okay, so it is very common practice that many patients, they are getting burns. Why? Many times the intensity is more. Clear? So in case of shortwave diathermy, the amount of intensity set by physiotherapist will be based on patient's feedback. Okay, for example, if I set any patients on shortwave diathermy machine, clear, so I cannot decide the intensity. Clear? I will have to ask to the patient that whether you are feeling properly or not, whether you are feeling more or less. Clear? So if I am giving too much of the intensity, definitely it may cause burns. Okay, it is simple mathematics. More the intensity, more the heat production, and there will be burns. Many times that is because of hypersensitivity of skin. Means the patients, like they are having diabetic neuropathy, so they are feeling less. Clear? So even though proper amount of intensity they are feeling, but actually excessive intensity is delivered to patient. Clear? So I am giving more intensity, but patient is feeling less. That's why patient is telling me, okay, you increase, but actual intensity that is delivered is more, so that may lead to burn. If you have any metal implant into your body tissue, so definitely the metal implant will be having more dielectric constant, so this field will be concentrated in that metal implant. So what is happening, the inside this body tissue, okay, the temperature will increase too much because of concentration of this field into this metal implant, so that may also lead to burns. So we have to take care that we have to always check the sensation of the patient. Okay, we have to ask for any internal fixation or metal implant inside the body. Okay, so that is very common after fracture, that the patient may be having plates, screws, nails. Okay, so in that case we should ask first to the patient, okay, because it may lead to burns. Now coming to scald. Scald means it is because of moist heat, because of perspiration. Actually already the heat is given, okay, and it will increase the activity of the sweat gland, so there will be perspiration. Okay, so this sweating, this water content will be responsible for accumulation of electrostatic field. Clear? So that may lead to scald formation. Okay, so that is because of moist heat, okay, especially because of perspiration. If the patient is allowed to touch any part of the machine, so patient is not that much technical person, okay, to operate all these knobs. So many physiotherapy clinics, especially busy physiotherapy clinics, they are having this trend that they will teach to the patient, okay, that if you want to increase or decrease, you can manipulate from this knob. Why? Because they are busy somewhere else. So in that case there are chances of getting electric shock, so patient is never allowed to touch any part of physiotherapy apparatus. Coming to overdose, so if there is local inflammation, especially acute inflammation, so there is already vasodilatation here. Okay, so if we are giving overheating, so it will lead to further vasodilatation and it will increase inflammation. Clear? So this inflammation will increase. So definitely there are signs of the inflammation, that is pain, swelling, loss of function, redness. So all these signs will also increase because of overdose. So for this localized inflammation, definitely the dosage should be under control. It should be never overdosage. Clear? Then gangrene. So as we discussed, if the patient is suffering from any type of the arterial disease, okay, or any peripheral vascular disease, and if the patient is given shortwave diathermy to that part, clear? So shortwave diathermy will lead to vasodilatation and there will be increased metabolism, increased demand of oxygen. So again, it will need more and more blood. Okay, so as the patient is suffering from arterial disease or as the patient is suffering from any other peripheral vascular disease, these arteries, they are not sufficient or capable to maintain this flow of blood. Clear? So on the contrary, whatever the increased demand of metabolism, increased demand of oxygen, okay, that is not fulfilled, and ultimately the tissues, they will start dying. Clear? So it may lead to precipitation of gangrene. Then coming to faintness, so that is most commonly because of prolonged position. Like if the patient is given shortwave diathermy for 15 minutes or 20 minutes, okay, for chronic back pain, and the patient is in that position, in horizontal position only, then when the treatment is over and patient is coming to vertical position, so patient will be developing faintness. Okay, why? Because initially the patient was in horizontal position. Now when the patient comes into vertical position, so heart will have to pump the blood against gravity. Okay, then and then blood will be reaching to brain. So here in this case it will take some time. It is nothing but postural hypotension. So whenever the person is changing posture, especially from lying to sitting or lying to standing position, when the patient comes, so definitely there will be faintness. So here what should be the solution? Patient should be allowed to get vertical position gradually. Clear? So we can prevent this faintness. Then coming to giddiness. So giddiness occurs. Giddiness means it is heaviness of the head, okay, or sometimes there is vertigo. Vertigo means it is sense of spinning. Clear? So whenever this shortwave diathermy is given, okay, over the head area, okay, or nearby head area, so there will be concentration of this electric field in any region of head. So that may lead to giddiness. For example, if you are giving for neck pain, clear, so that is very near to head area. So whenever you are treating neck, so this electric field will not be limited to neck, okay, this field will be also going into brain tissue, clear. So that may lead to giddiness, especially whenever there is concentration of this electric field into the head area. Danger to hearing aids or cardiac pacemakers, because all these are electronic equipments. So hearing aid, that will be also working on frequency. Cardiac pacemakers, they're also working with frequency, and they both are electric device also. So what is happening, this hearing aid will be damaged because of this frequency of shortwave diathermy. And cardiac pacemaker, definitely it is working with some rhythm. Cardiac pacemaker means it is one of the battery operated device that will give continuous impulses to the heart. Or cardiac pacemaker, you can simply tell it, it is artificial SA node, okay, so that will be providing electrical stimulation to heart, okay, at regular intervals. So it is nothing but one type of the heart beating device, okay. So this rhythm of this cardiac pacemaker may get disturbed because of this electric field of shortwave diathermy. So this hearing aid should be always removed whenever your patient is having it, okay. Cardiac pacemaker, that is implanted, that cannot be removed, so it is advisable to avoid this patient, okay, for shortwave diathermy, okay, because this may disturb the rhythm of cardiac pacemaker, okay, and it may be life threatening also many times. Danger to other equipment, so it is always advisable that other electrotherapy modalities of IFT or TENS or electrical stimulation, that should be away from this shortwave diathermy machine, because there will be widespread of this electric field around this shortwave diathermy machine, so it may disturb the frequency, or it may disturb the function of this other electrotherapy modality. Very simple example if I would like to give, so if you want to play radio, okay, just in the near area of your shortwave diathermy, so you will not be able to get clear voice of your radio, clear. Why? Because there will be interference. The terminology is interference of this frequency by shortwave diathermy machine. Now coming to contraindications. So contraindications means what? Contraindications means we are not supposed to give this modality shortwave diathermy if any one of this is present in our patient, clear. Some of them, there will be absolute contraindication. Absolute means we are not supposed to give at all, and some of them, they are relative contraindication, means we can give but with precaution, clear. So open wound or hemorrhage, so definitely the open wound will be having more tendency of the bleeding, and hemorrhage, so definitely it is already bleeding, clear. So this shortwave diathermy will cause vasodilatation, so this vasodilatation may lead to excessive bleeding, clear. So it is not advisable to give shortwave diathermy in patients with open wound or hemorrhage. Metal in the tissue, so it is very common that patient will be having nails, plates, screws after any surgery. So in case of this metal, it is having more dielectric constant, so instead of passing from human tissue, the field will be concentrated into that metal, okay, and there will be excessive concentration of this electric field in such a way that the surrounding tissue of this metal will start getting damaged, okay. So many times what happens that if the excessive damage occurs surrounding the tissues of these metals inside the tissue, then after the patient will be able to judge that there is some damage, clear. So it is always advisable not to give shortwave diathermy to the patient, especially on the local part, okay. So that is relative contraindication. If the patient is having patella fracture and patient is treated with the K-wire is already there, so definitely we should not treat knee joint. But if the patient is coming for shoulder pain, then over the shoulder diathermy can be given, clear. So over the body part where the metal tissue is available, diathermy is not placed. Disturbed skin sensation, so definitely, as I already told, that amount of intensity will not be decided by therapist, it will be decided by patient, clear. So if the patient is having disturbed skin sensation, patient will not be able to judge exact amount of intensity that he needs. Clear? So if the sensations they are reduced, so even if we are giving more intensity, the patient will not feel more, and ultimately it is starting damage to skin. Clear? So it is always advisable to treat this disturbed skin sensation patients with precaution. Venous thrombosis or thrombophlebitis. So it is nothing but one type of the vascular problem. So if we are giving shortwave diathermy to the patients of venous thrombosis or thrombophlebitis, it is possible that thrombus may dislodge from internal side of the blood vessel. Okay, that may go into blood circulation, and that thrombus may reach to any part of the body by blood circulation, and it may block any artery. Like if this thrombus is detached from lower limb, okay, and if it is going into the pulmonary circulation, so it may lead to pulmonary embolism, so that may be life threatening. If this thrombus goes into brain, so it may lead to stroke, that is hemiplegia, half side of the body will be paralyzed. If this thrombus goes into coronary artery, so it may lead to ischemic heart disease. Clear? So it is not advisable to treat patients of venous thrombosis or thrombophlebitis with shortwave diathermy. Same is applicable for arterial disease, but here one more point we need to discuss, that in arterial disease the arteries they are not capable enough for vasodilatation. So when we give shortwave diathermy, so definitely the vasodilatation should happen, but this arterial disease will not be allowing this vasodilatation to happen. So many times it is possible that there may be chance of bleeding inside. Clear? So in case of arterial disease, just because these arteries they are not capable of proper vasodilatation that is required as a effect of shortwave diathermy application. Okay, so we should avoid these patients, okay, for shortwave diathermy. In case of menstruation in female, especially when they are in this active phase of the menstruation, it is advisable that not to give shortwave diathermy over the back or pelvis region. But definitely if the female comes in this menstruation phase only, for shoulder pain or knee pain, okay, patient can be treated. So it is contraindication over the local area. Okay, same in pregnancy, because this electrostatic field may damage the fetal tissue. Clear? So again this pregnant lady should not be given shortwave diathermy over the pelvis region or back region, but again over other areas it can be given. In case of tumor, there will be excessive division of the cells. Okay, so as we discussed, any chemical process, okay, will be getting accelerated by this heating process. Okay, and metabolism will also increase. So this metabolism will increase the tumor growth. Okay, because it is one type of the chemical process and it is one type of the metabolic activity, so both will be increased. Clear? So tumor will increase in size, or we can say that we are stimulating the growth of tumor. After deep X-ray therapy or cobalt therapy, there will be devitalization of tissue, because that will be very difficult to tolerate by our tissues. So after this therapy by X-ray or therapy by cobalt, okay, it will be devitalization of the tissue. So it is possible that it may further damage this tissue. Then coming to children, so here the children, they are not actually cooperative people, so those can guide us for proper adjustment of intensity. So definitely for children it should be given with practice. Then coming to mentally retarded people, so here again there will not be proper individuals to give us feedback regarding exact amount of intensity needed. Clear? As we discussed, the intensity of the shortwave diathermy, it is not to be decided by therapist. Definitely the therapist is moving intensity knob, but whether to increase, decrease or keep as it is, it will be decided by patient. Okay, so we have to be dependent on patient's feedback. So children and mentally retarded patients, they cannot give this type of feedback. Same is applicable for unconscious patient, because they are also not in condition to provide feedback. In epileptic patients also the effects are not clear, so it is possible that epileptic attack may or may not come during this shortwave diathermy, because these effects they are not clear yet. Clear? So it is advisable not to give to this epileptic patients. In case of uncooperative patients, definitely they will be also not giving proper feedback. So we can say that point 10 to 14. So just because we are not getting proper feedback, okay, from this type of the people, okay, or sometimes we don't know what will be the effects are not clear, okay, so it is advisable not to give this shortwave diathermy. Now whatever we learned till now, it was capacitor field method. Now next is cable method. It is also known as inductothermy. So frankly speaking, no one is using this method nowadays, okay. So actually what is done here, so one insulated cable will be there, that will be useful for treatment purpose, okay. So that will be wound around the patient's limb, okay. So what is happening, so around that particular cable there will be formation of electric field or magnetic field, or sometimes both, okay. So this electric field or magnetic field or both will enter into the tissue and will be working as therapy. But as I told, no one is using nowadays for this cable method. Now as I told, this cable is coiled around the patient's body, and definitely it should not be in direct contact with body part. It should be separated by layer of insulating material. So you can think like that, you have patient's upper limb or lower limb. Over that upper limb or lower limb, you are circulating one layer of bed sheet, okay, and over that you are preparing this cable, okay. Now this bed sheet may be having multiple layer also, okay. It is based on patient's requirement, but it should not be in direct contact with patient's body. There should be proper layer, okay, of insulating material between the patient's body and this cable. Cable method or this inductothermy method has its own advantages as well as disadvantages. So which are the advantages? So first of all, it is able to cover the extensive area. For example, if I want to cover whole upper limb or whole lower limb, so that will not be possible by this capacitor field method, because it can cover one joint like ankle or knee, but it cannot cover whole lower limb, okay. So here I can wind this cable, okay, around the limb in the spiral method. So that will be covering the extensive area. In the similar way, if I use the capacitor field method, I can treat shoulder, okay. So that is one of the joint, but if I want to treat whole upper limb, definitely I will have to use the cable. So cable will be covering my whole upper limb in the spiral manner. Now I can treat irregular area of the body with cable method. Clear? So for example, if we consider shoulder or knee, okay, so they are not flat, okay, they are not in one plane, they are always in rounded shape. So it is possible that by capacitor field method our electrode is not having proper distribution of this electric field around this shoulder or around this knee joint, because the elevated part, for example, if we think of the knee joint, so the elevated part, that is of condyle part or patella part, okay, so that will be getting more concentration of this field, but the remaining part, those will be getting less concentration of the field. So irregular areas will be better treated by cable, because the cable will be at the same distance whatever the shape of the area is. Clear? Okay. And this cable method will also avoid the subcutaneous fat heating. So these are advantages. Now disadvantages. So it is impossible to use air as spacing. Why? Because whenever we are binding this cable over this limb, okay, so definitely we should put one insulating material, okay. So just imagine that there is limb, okay, that limb is surrounded by few layers of the bed sheet, okay, and this bed sheet is having this cable or wire. Clear? So here the bed sheet will be working as spacing material and the cable will be resting on that bed sheet. But if you think of the air, so definitely the cable cannot rest on air. It will directly come in contact with body parts. So that is not advisable. So here we will not be able to put the air as one of the spacing material. Now pulse shortwave diathermy. So the name itself, it is telling, it is giving shortwave diathermy in pulse mode. Pulse mode means it is not coming continuously, but it is providing simple interruption in the output of continuous shortwave diathermy. Clear? So there will be on period, off period, on period, off period. Likewise, the modality will go. What will be the parameters for this? So frequency, pulse frequency and pulse width we will have to consider. So frequency means overall frequency, pulse frequency means in 1 second how many pulses are coming, okay, and pulse width means for what time duration the pulse is on. So here the values are, so frequency is same as compared to continuous shortwave diathermy, so that is 27.12 megahertz only. Pulse frequency may range from 25 to 600, clear? So PPS means 25 to 600 pulse per second. And pulse width, okay, so that is the duration of on period, so that will be from 20 to 40 millisecond, and 65 millisecond is most commonly used. Okay, these are my references. You can ask your question if you have. Thank you.